I've always liked the saying, give a man a fish, he eats for a day. Teach him how to fish, he lives forever. Our guest today is doing exactly that. Culinary medicine is a growing movement in healthcare that blends nutrition, science with hands-on cooking. The goal is to help prevent and manage chronic diseases. Nate Wood is Director of Culinary Medicine at the Department of Internal Medicine at Yale School of Medicine. Thank you very much for joining us today.
Yeah, thanks for having me.
Particular fondness. I too am a nutmegger, so we always like a chance to feature the nutmeggers, and particularly when the nutmeggers come to cooking, it's always something that's all close to our hearts. So we have an expert here. We're not going to be talking about pizza today. We're going to be talking about other things that may be a little bit more healthy, although we're not going to discount anything on pizza for sure. But I want to get into a little bit about exactly what is this whole idea of a culinary kitchen. So if you can kind of just give us a start, like how would you define the concept of a culinary kitchen, and what makes it kind of unique from just your typical cooking lesson?
Yeah, so this idea for a teaching kitchen is like maybe 15, 20 years old. So this is kind of a new concept. And teaching kitchens look really, really different. Sometimes it's like a pop-up that you do in a conference room with a couple of hot plates. Sometimes it's a big, beautiful kitchen that's just dedicated to teaching, like we're lucky to have at Yale. Sometimes it's like a cafeteria or a restaurant space that's occasionally converted into a kitchen that's used for teaching. But the goal is really that you have this kitchen where people can engage themselves in hands-on cooking. So you're not just watching someone cook and learning to cook, you yourself are doing the cooking. And the main goal is teaching, right? So it's not like we're cooking food to serve to others or to bring out to the community or to have kind of a restaurant style meal. The goal is the cooking itself, is the learning. And then the bonus is that you get to enjoy the product at the end, which is some delicious food. But this idea that you can learn to cook healthy food by doing it yourself is really the goal of a teaching kitchen.
Why is the hands-on part so important? Why do you find that?
So there are lots of barriers to people eating healthfully, I think. One is knowing how to get the healthy food, knowing is what even is healthy food. But then another big one is how to prepare this healthy food in a way that makes it still taste good, right? Because we have tasty food at our fingertips at all times, whether that's fast food or things from restaurants and other pre-prepared foods, right? But if we want to be able to eat healthy to support our health, that food's going to have to taste good. And so learning how to do that in the teaching kitchen, how to take healthy ingredients, how to use proper technique and safe knife skills, kitchen safety, and to make meals that are healthy, but then still taste good by using lots of spices and fresh herbs and delicious acid and fresh, delicious ingredients. I think that's really the secret sauce of teaching kitchens.
Nice. I'm curious, what kind of challenges, what kind of questions people come in with? Like, do you find the people who are coming in, are they like total novices to cooking? Are these like people who, or are they like people who are great chefs and they just like want to get some new ideas? I'm kind of curious what the make of the audience is.
Yeah, what's fun about the teaching kitchen is we have this whole gamut of people who are, in their seventh, eighth decade of life and really have never cooked anything, which is always fun for us. We have young folks who are, been watching TV and have a good idea of how to cook. They watch YouTube videos and TikToks about healthy cooking, and they're maybe better at it. We have lots of, moms and dads who've been cooking for their family for 10 or so years and are really quite good in the kitchen, and they're just learning to make it a little healthier to kind of level up. So we have all different magnitudes of kitchen skill who are coming into the teaching kitchen. And whether you're learning about the techniques, whether you're learning about the healthy cooking techniques, whether you're learning about the science of nutrition, there's kind of something for everyone in the teaching kitchen. But one of the most fun parts is that we really can address some knowledge or skill barriers with basically anyone of any knowledge or skill level.
So I'm kind of curious, what are some of the like specific chronic diseases that you find you can address, and like what are some of the strategies that you use to attack those issues? Like if, for people who are listening, it's like, I've always kind of had this condition, I wonder what I should be doing better. What are some just kind of?
Yeah, great question. Something we frequently get asked is, what is the best diet for diabetes? What is the best
Right.
diet for weight loss? What is the best diet for heart disease? But the truth
Right.
is the best diet is really all kind of the same, right? If you have a chronic diet related or metabolic condition, the chances that a plant-forward diet could help you are nearly universal, right? So a diet that is impactfully full of fruits and vegetables, whole grains, nuts, seeds, legumes, lean proteins, salmon and other fatty flesh fish, The that type of diet is going to be supremely helpful for people with a host of diseases. So if you have obesity or overweight, if you have fatty liver disease, type 2 diabetes, if you have a history of heart attacks or strokes, if you're at risk for dementia, peripheral vascular disease, the list goes on, right? All of these chronic diet related diseases, it's really the same type of dietary pattern that's helpful for both prevention and treatment. So we get all of those folks, and then some folks who are just interested in prevention as well and don't really have any diet related diseases that they're looking to address. But I think that's something that's really empowering to patients, is to hear that this general healthy eating pattern is not good for just one possible condition that they have or may have in the future, but that it's good for preventing and treating all of them.
I'm curious, just along that same theme, whether um, you look at kind of some of the digestive issues as well. Like a lot of people, have like a lot of basic, it's not like a severe chronic condition. It's just like their digestion is kind of off whack. And you talk to a lot of nutritionists and they say, well, what have you been eating or how have you been eating? I'm curious if you look into that at all.
Yeah, I think a lot of digestive issues at its root are from people eating diets that are low in anti-inflammatory foods, low in fiber, high in ultra processed foods, right? And so if we're eating a lot of like greasy foods, refined grains, fast foods, ultra processed foods, the chances that we're going to have some digestive discomfort are quite high. If we're eating those things that are fiber full of antioxidants and fiber, fruits, vegetables, whole grains, nuts, seeds, and legumes, or in shorthand, plants, right? If we're eating those things, the chances of having digestive issues, I think, is much lower. So we are able to address some of that in the teaching kitchen. There are, of course, some specific digestive issues that require more focused and one-on-one tailored medical nutrition therapy, like IBD, IBS, celiac, gastroesophageal reflux disease, right? And so those types of things we can provide some guidance for in the teaching kitchen, but it's really this general healthy eating pattern that benefits the vast majority of people that we really, I think, succeed in the teaching kitchen.
I was curious also about one other aspect of kind of the culinary teaching, um, which some people, I've heard some people talking about, which is use of different spices and to the extent which spices can kind of help or hurt in the process. And I'm kind of curious, kind of what your take on that is.
Yeah, my advice to people is to spice up their life, certainly, yes. So spices are really good. Even by themselves, we know that these spices are good for us. They contain lots of antioxidant compounds, right? They come from things like roots and bark, right? And are really, really good for us. You've seen them in a variety of colors, and we know that these colors represent different active plant compounds that can help lower inflammation, right? But I think the bigger piece here is that when you use lots of spices, you potentially are able to use less oil and less salt, and the food still tastes really good. So it's all
Hmm.
about how can we enjoy this healthy food without using some of those things that are universally enjoyable, but perhaps not super good for our health, like a whole bunch of saturated fat, added sugar, added salt, right? And so we're frequently talking to people about when you make your food at home, really season it. So in our first class that we do in the teaching kitchen, we make something that everyone knows and loves, which is tacos. And we do a whole number of varieties. And one variety we do kind of the standard American way with flour tortillas, beef, onions, and a store-bought seasoning mix, which has tons of salt in it. And on the
Yeah, yeah.
opposite end of the spectrum, we do a whole grain corn tortilla with lots of vegetables and beans. And then we use a salt-free taco seasoning that is made in the teaching kitchen. So kind of emphasizing to folks the power of these spices and how it allows you to cut back on that salt.
So what goes in just give us a hint of your secret recipe on that taco seasoning mix. What's in there?
Yeah. Oh gosh. You would have to ask the dietitians. Let's see what I can
Okay.
do by heart. I know there's cumin. I know there's chili powder. I know there's oregano, and beyond that, I'd have to defer to the
Okay.
dietitians.
No problem. So when people come in to the cooking kitchen for the first time, um, what is it that surprised them most, and like what's the process like? How does the program actually work? Like if you can kind of walk through.
So anyone who has a Yale New Haven Health provider or physician is able to be referred to the teaching kitchen. All the classes are totally free, which is a really amazing resource to patients, especially for patients who are uninsured. And so they come to the teaching kitchen, they take an introductory class, and then after that introductory class, they're able to take up to 5 other ones. So that intro to culinary medicine class is where we make all those varieties of tacos. But then there's also a breakfast, lunch, dinner, full menu ideas, and snacks class. And the snacks class, of course, is everyone's favorite. And then we offer a variety of virtual options as well. But they come into that first class. We talk about the basic tenets of healthy eating. We show them some basic knife skills, kitchen safety. Everyone makes the tacos and gets kind of a feel for what this whole culinary medicine thing is going to be like. And then after that, we really leave it up to them. You know, most places who do culinary medicine, it's like a set of 6 weeks, and you have to come once a week for 6 weeks. And we just hope it works with people's schedules. But the way we do things here is we offer a bunch of classes all the time, and they can sign up for them whenever works for them. So we find that flexibility really works well for people, but they start by coming into that intro class, and then the world is their oyster.
And I'm kind of curious, is there follow-up? Yeah, is there a way that you kind of see if you're getting better results as a result of kind of teaching rather than just telling?
Mm. Yeah, there's really good research in the field of culinary medicine that's been going on for a couple of decades. And so we know that culinary medicine interventions help people lower their blood pressure, their BMI, their sugars, their cholesterol. It improves quality of life. It improves their adherence to a Mediterranean diet, right, which we know is good for us. So the research has shown for a long time that this culinary medicine is super effective. We recently did a retrospective analysis of our patients, and they mentioned that they feel more comfortable cooking healthy foods. They're enjoying cooking healthy foods more. They're enjoying eating healthy foods more. So we've seen some of those really positive changes. And then in the next few months, we're going to launch a long-term, 3, 5 year longitudinal study to really follow up on patients and prove for ourselves and for our patients that what we're doing here at Yale is really benefiting patients' health.
Have you seen that the teaching the people how to cook, it's helped in ways other than just with their nutrition, with their confidence, with their their thoughts about cooking itself? Are you cultivating some new great chefs, the next great chefs?
Yeah, I sure hope so. Yeah, I think the patients coming into the teaching kitchen, really inspires a lot of them, right? Because I think it, especially in the modern day, feels like this big barrier of like, oh no, I'm not a chef. Like, I don't know how to cook. I can't be in the kitchen, right? But then after a few classes, people realize, oh, we humans have been cooking for so long, and this is not some, hard won skill that only a select few can do. This is something that we all deserve to do and enjoy. And so we're hoping to have some, iron chefs that'll come out of the teaching kitchen in the coming years. But certainly, I think the most heartening piece to me is that people are enjoying this process more. This is not something they're trying to minimize in their life because they don't enjoy it and they feel like they're not good at it, but something that
Right.
they're relishing and spending time doing. And then that result is that they're not only enjoying the product, the healthy food, but they're enjoying the process as well. And when that's the case, they're more likely to do it, I think, and their health will be all the better for it.
Are you finding, you say it's a five part series? Are you seeing people are asking for more?
Yeah, so people come into that first class, and then there's 5 parts after that, and then they max it out, and they're like, "Well, what now? I still want to come back, right?" And
Yeah,
so
yeah.
we started offering some virtual classes, 1 to 3 a month, so that people can
Okay.
stay engaged. And I think in the future we'd like to do like maybe some condition specific or some culture
Yeah.
specific classes. But
Interesting.
all of that certainly to say that people want more than 6 classes.
Yeah. Interesting. So slightly different direction. But since I got you, definitely want to take advantage of the opportunity. RFK Jr., they came out with a new food pyramid. Um, Certainly very interesting. Talked to a bunch of people who had a couple of different opinions about, not everyone's going to agree on anything, on everything for sure. But I'm just kind of curious what your take is on how they're seeing the new food pyramid.
Yeah, I think the food pyramid being upside down, the way I describe it is like, I think that was an idea that they had, and it sounded so cool and revolutionary that they just decided to stick with it. Even though, if they really thought about it, there probably would have been a better way to represent what they were trying to say. And I think what they're trying to say is we should not be eating ultra processed foods, which I think most people can agree with. The less of those, the better, especially ones that are high in salt, sugar, and saturated fat. They're trying to say we should eat lots of fruits and vegetables. Everyone can agree with that. They're trying to say that we should eat whole grains whenever possible, as opposed to refined grains. I think everyone can agree with that. And then they're trying to say that protein is important, which again, everyone will agree with. The specific amount of protein they're suggesting, I think, is quite reasonable. And I think most people would agree. Some people might argue it's a little ambitiously high, but I don't think anyone would say it's dangerously high. And then I think where people are finding the most issue is in the recommendations, really support of red meat, and full fat dairy and other animal products. Whereas, I think the research would really say the more plant-based proteins that we can eat, the better. So beans and other lentils and legumes and nuts and seeds and whole grains inclusive, other plant-based sources of protein, I think really are better for our health. And it's okay to eat it's okay to eat animal-based sources, red meat inclusive, but I think in much smaller amounts than is being represented in the food pyramid. So
But
lots of good things there, but certainly some things for concern.
I was personally a little bit curious that somehow carbs made it all the way to the bottom of the pyramid. I know a lot of people just are not into the carbs, but I didn't think this now was a time to demonize carbs, but sticking them on the bottom. But I don't know. What's your thought on that?
I think the original food pyramid way overestimated how many carbs we need. If I remember right, I think it recommended 6 to 11 servings per day, which 11 servings of carbs is quite extreme, right? And so I think they were making a statement that that was industry influence and that we were being led astray and that they're going to flip the pyramid and make things right. So I think it's a political statement about that. But as far as the amount that they're recommending, I think they're recommending 2 to 4 servings of whole grains a day, which is quite reasonable. And then lots of other sources of carbs could come from the vegetables quadrant, things like sweet potatoes and corn. So I think overall it's quite reasonable. But again, I think a lot of it's political grandstanding.
Well, at least as we can get some pizza in there, I think all is going to be okay.
Amen.